I think we're going to go ahead and start here pretty soon for our update. It's still of course, an update for both the media and for the community, but all of us are doing it virtually from different locations across the city. I want to start by saying, of course, it's our update for February the 3rd. After I give some remarks, we're going to have Dr. Davis, who leads our response, of course, from a public health perspective, also give some remarks, and then we'll have some questions, and then as well some Spanish translation like we always do at the end. So I want to, we have a brief update today, but I wanted to give everybody a little bit of an overview as to where we are. We actually had a very large presentation to the Long Beach City Council and the public just last night on kind of the status of where we are with vaccinations and testing. The city, believe it or not, has completed over 660,000 tests, COVID-19 tests here in the city of Long Beach. That testing continues, and we want to remind everyone at the start of this update that if you are feeling like you've been exposed or you have symptoms, to please get tested. And we have full crews out there doing that work every single day. We also, in the city of Long Beach, we are now nearing 50,000 vaccinations that have happened here in the city. We're extremely grateful to our own Long Beach Health Department, but also to our partners, Memorial Medical Center, St. Mary Hospital, some of our pharmacy partners we have in the city, and so many others that have been really working with us to ensure that we get the vaccinations out. That includes Cal State Long Beach, Long Beach City College, Long Beach Unified School District, and so many other partners. So it's been a success so far. Want to note that thanks to the health department, Dr. Davis, our whole team, our vaccination rollout has really gotten, I think, some really great interest from the state. The governor himself has said that he views our process as one of the best in the state. There was a great report today also in the media about how we're doing, and that work is because the health department has been planning for 6 months to get this vaccination program rolled out. So where are we at today and what's next? We know that we have completed most of our healthcare workers, our nursing homes, paramedics, firefighters, police officers, emergency response. And now we are, of course, continuing to work on food and grocery workers and also educators and school staff at Long Beach Unified, which was the first school district to get vaccinated. Of course, Long Beach City College, some essential workers, and we just started Cal State Long Beach just yesterday was their first day of beginning to roll out vaccinations to their faculty and, of course, to their custodial staff, janitorial staff, folks that are on campus working every single day. So we're really proud of all those educators. But what we've been doing every day and the vaccinations we've done the most of have been for our 65 plus seniors. So they have been the group that has received the most vaccinations in the city. They're also the largest group. And we do those every single day. And so as far as what our plan for this week is, all week, every day, we're vaccinating 65 plus seniors in a partnership with Memorial. We have an active clinic at Memorial Hospital, and we send our seniors there. And we're vaccinating, of course, at Cal State Long Beach. It's happening all week as well. And our own health department, of course, is working to do second doses. So everyone that had a second dose this week is receiving their second doses this week. So we're busy doing that at the Long Beach Health Department also. Please note that if you have a second dose that's coming up, maybe next week or the week after, you will be receiving an alert from us over the course of the next few days or week about when your appointment is. So there's no need to call, no need to check in. As long as your date is after the date on your card, we're going to get to you within that first week, that second week of that date, per the CDC guidelines, and get you vaccinated. So your second dose is coming soon if you're waiting for your second dose. In addition to that, if you are a 65 plus senior or a teacher or a grocery worker and you're just waiting for your vaccine, please know that the team is going through VaxLV. That is where we're pulling information from. So every single day, the team goes into the VaxLV system, pulls seniors 65 plus, and schedules them to get appointments. If there's healthcare workers in there that maybe weren't vaccinated early on, they pull the healthcare workers and put them into clinics. And the same will happen as more teachers and others get vaccinated as well. So the best way to get vaccinated in Long Beach is to sign up at VaxLB, and you'll get notified as more vaccines available. And I think we all are aware there is a national vaccine shortage. We are doing as much as we can, but we're proud of what we're able to do. And we're working very closely with the state governor's office to ensure that we have the adequate supply to do all of our second doses and to continue to vaccinate new folks as we're doing this week. I also just want to add that we are now beginning conversations to roll out programs to ensure that we're focusing on equity as it relates to vaccinations. We have been hard at work on ensuring that if you're a low-income community, maybe it's a Spanish-speaking community or Khmer-speaking community, or zip codes that may be harder to access, we want to make sure that we're going to be going into those neighborhoods. You're going to start seeing mobile vaccination trucks and clinics going into these neighborhoods to ensure that we're vaccinating these really critical communities. We can't be in a situation where if you don't have a computer or if you don't speak English, that you get denied a vaccine or that you don't have access. So we're going to make sure everyone has access, and we thank you all for your patience on all of this as well. Also, we know coming up, we have transitioned so far to our personal services, like our barbershops, our nail salons have begun to reopen. And also know that a lot of our restaurants now have our back to outdoor dining and the parklets continue to stay safe. I know it's a busy weekend, football and folks that want to be out with each other. We need to stay safe. We need to ensure that we're keeping our distance and we're wearing our masks and that we are protecting each other, because while hospitalizations continue to decrease, there's still a lot of need in our hospitals and our nursing team. So thank you everyone for where we're at. I'm very hopeful that this next week or two, we're really going to start seeing those vaccinations really crank up, hopefully from the state and feds, and will be more good news for us in Long Beach. We continue to work through that VaxLB list. And so with that, I want to turn this over to Dr. Davis, who will also give us a little bit more update on vaccines. Dr. Davis.
Thank you, Mayor Garcia. Good afternoon, everyone. So as of today, 48,824 Long Beach residents have tested positive for COVID-19, and we've lost 694 Long Beach residents to COVID. 287 residents are currently hospitalized, and our positivity rate has thankfully decreased. As of today, it's 9.7%. That's the lowest it's been since December 9th, when our surge was really taking off. I want to talk a little bit about some of the variants. There have been some recent confirmed reports of a COVID variant known as B117, or the variant that originated in the United Kingdom, in Los Angeles County, as well as in some neighboring areas. This is the variant that was discovered in the UK last fall. Variants originating in South Africa and Brazil have also been found in the United States, but they have not been discovered in California up until this point. So as of now, we have not seen those other variants in California. As viruses constantly change through mutation, new variants of a virus are expected to occur over time. And some of these variants emerge and then they fade away. And then other times these variants appear and they persist and actually increase in our population. It's believed that the B117 variant is spreading in the county. Currently, while there's no definitive evidence that the B117 variant causes more severe illness or increased risk of death, the presence of the variant means that virus transmission can happen more easily in our community. January was the deadliest month so far in Long Beach, with approximately 245 new COVID-19 related deaths reported, in comparison to 150 deaths in December. So we cannot allow this trend to continue. The current vaccines that we have available, the Pfizer and Moderna mRNA vaccines, are effective against this UK variant. We don't know what the future holds as far as variants. Whenever a virus is replicating or dividing, is being transmitted from person to person, it can mutate and form different variants. And we don't know how those variants will act with regards to COVID-19 vaccines, COVID-19 treatments, the transmissibility of the virus, or the severity of the disease. In order to have fewer variants, we need to have less virus circulating and transmitting. And so that means getting vaccinated if you have the opportunity and continuing all of the precautions that you've heard many times before. Wearing a face covering, not gathering with people outside of your household, avoiding crowds, washing your hands, and staying home when you're sick. Following these precautions can quite literally be a matter of life or death for some. And while we're seeing other numbers, such as new cases and positivity rate trending down, which gives us hope, this is certainly not the time to let up. This is the time to really double our efforts and to continue the good news that we're having right now. Even as we continue to vaccinate people, we still need everyone to continue taking all the precautions for the next several months, if not longer. We must all be more diligent in implementing health and safety measures to help limit the spread and keep our communities safe. The proper use of a face covering, maintaining physical distance, and staying home as much as possible continue to be our best protection, even after you've gotten a vaccine. These strategies will only be effective in slowing the spread if they're followed by everyone all of the time. And I thank all of you who are already doing this and making this sacrifice and these changes. This is why it's so important that even though the regional stay-at-home order has been lifted and more activities are allowed, that we continue to be thoughtful in making decisions and not rush to resume activities that could potentially put us at risk of transmission. Thank you for continuing to work together to keep yourselves and each other safe. Thank you. I'll turn it back over to Mayor Garcia.
Thank you very much. I think we're going to take it. There might be a couple of questions which we'll take.
Yes, thank you, Mayor Garcia. We will now take media questions. As a reminder to media, there will be time for one question each. Any additional questions can be sent to the Long Beach Joint Information Center. First question comes from Kelly with the Long Beach Post. Go ahead and unmute Kelly and ask your question.
Hi, can you hear me?
Yes, we can.
Hi, this question is for Mayor Garcia. Mayor, you touched on this a little bit with the mobile clinics, but obviously in Long Beach and cities across the state, there's significant disparities in vaccine rollout for race and location. In Long Beach, it's predominantly white. East Long Beach, or East area residents are getting the vaccine. Can you just talk a little bit more about what Long Beach is doing to address these disparities, and also when you plan to roll out these mobile clinics and maybe some of the neighborhoods that you're specifically looking at targeting?
Yeah, I think first, the equity question is something that we got to take, head first and get really focused on. And so that's something that I'm really proud the health department is being proactive about that. It's also a complicated question because, yes, if you look at those numbers, who's getting vaccinated and where, a vast majority of folks are getting vaccinated in Long Beach are 65 plus. We also know that the eastern portion of the city is older than the rest of the city and is also wider than the rest of the city. And so as far as who's getting vaccinated, it's both an equity question and also understanding what the older population in Long Beach, who that's reflective of, and who makes up kind of the younger population of the city. So the younger folks in the city are more predominantly people of color and more mixed. And so there is going to be some, I think, interesting, we're going to have to be very, very creative, and we're going to have to be thoughtful about the way we handle equity to ensure that we continue vaccinating the people that are most at risk, which are 65 plus folks, and understanding also where they live and who they are, while also ensuring that we're focusing in on zip codes where, yes, they might be younger folks, but where equity plays an important piece of that. And so what the health department is doing is they've set up, and I don't know if I have dates, we can get those to you, but they are going to be rolling out these mobile clinics and vaccination sites in zip codes that have been highly impacted by COVID, or where there have been a lot of positive cases, and setting up clinics. They're going to be going door to door. They're going to be going to neighborhoods that could be maybe a neighborhood where there's a lot of folks that are Khmer speakers or Spanish speakers. And they have partnered, the health department has brought in, I want to say, maybe 6-7 organizations that are well known within the community that work within these populations to help them guide this vaccination work. And so those groups have been announced, I believe, or certainly it's public, so I'm sure we can get you who those organizations are. And they're now helping us do the work. And so we want to map a really pathway to equity. I think that it's very important that we focus on that and do the best we can. So we're learning as we go, and hopefully can make improvements as we go as well.
Great. Next question comes from Haley at the Press Telegram. Haley, go ahead and unmute and ask your question.
Hi, can you hear me?
Yes.
Okay.
Yes, we can.
My question is for Dr. Davis. So as the city expands its vaccine rollout, I'm curious if the city is often seeing that there are leftover doses that are at risk of expiring, and is the city using a wait list or some other method to contact people when there are these leftover doses that could expire?
Hi, thank you. So we are very careful about our planning and our appointment making so that we don't have extra doses. And when we do have a proximity list that is still following the tier. It's still, targeting and focusing on the people that are eligible right now, that live close by, that we would be able to vaccinate with leftover doses. But it's been very few and far between.
All right, that concludes questions. We will now move on to Spanish interpretation.
Buenas tardes, gracias por acompañarnos. Hoy es nuestro comunicado de prensa para el 3 de febrero del 2021. En un momento hablaré sobre nuestros números de COVID-19, información importante relacionada con las mutaciones del virus COVID-19, pero primero les daré a todos una actualización sobre el lanzamiento de vacunas. Long Beach continúa haciendo un trabajo increíble para las vacunas y hasta la fecha nuestro Departamento de Salud ha administrado casi 50,000 dosis de esta vacuna. Desde nuestro último comunicado se han administrado un total de más de 12,000 vacunas aquí en la ciudad. Como muchos de ustedes saben, hace unas semanas comenzamos a usar el centro de convenciones de la ciudad de Long Beach como un sitio de vacunación masiva, lo que nos permite vacunar a un mayor volumen. También hemos continuado vacunando a nuestra población de adultos mayores a través de nuestro Departamento de Salud y nos hemos asociado con Long Beach Memorial Medical Care Center para ofrecer un sitio de vacunación de adultos de mayores de 65 años. Hemos continuado vacunando a los trabajadores de alimentos, incluyendo los trabajadores de supermercados y restaurantes, que sabemos que son empleados esenciales y en la primera línea todos los días en esta pandemia. Desde la semana pasada comenzamos a vacunar a educadores en la ciudad. La vacunación de nuestros maestros y proveedores de cuidado infantil es fundamental para que los estudiantes regresen a la escuela y a otros entornos de aprendizaje. Ayer mismo mencionó el alcalde que se empezó la vacunación a aquellos maestros educadores de la Universidad de Long Beach, Cal State Long Beach. Hasta la la fecha, más de 10,600 adultos mayores y 6,400 educadores y 2,500 trabajadores de alimentos han sido vacunados aquí en nuestra ciudad. Aunque ciertamente tenemos la capacidad de administrar mucho más, tenemos que tomar en cuenta la cantidad de vacunas que estamos recibiendo semanalmente. Con eso en mente, hemos cambiado nuestro enfoque en proporcionar segunda dosis a quienes recibieron su primera vacuna en el mes de enero. Como mencionamos la semana pasada, la segunda dosis seguirá siendo la prioridad durante el mes de febrero. El Departamento de Salud se comunicará con las personas que recibieron aquella vacuna en un sitio operado aquí por la ciudad para poder programar su segunda cita. Si usted recibió esa dosis en otro sitio, ellos son los que tienen que contactarlos. Por lo tanto, no necesita comunicarse usted con el Departamento de Salud para hacer la segunda cita, y le pedimos a todos que por favor sean pacientes y sepan que nos vamos a comunicar con usted. Se les pide a las personas que se pongan su segunda vacuna tan pronto como se les informe la disponibilidad. Además, es fundamental que las personas no compartan en el enlace de su cita, ya que afectará la capacidad de otras personas y tal vez también de usted. Aunque se recomienda que las vacunas se administren durante un periodo de 21 a 28 días, dependiendo de qué vacuna recibió, si fue la de Pfizer o de Moderna, según el fabricante, la guía de los CDC indica que la efectividad no se reduce si la segunda dosis es administrada después de esos 21 a 28 días, con que sea durante las 6 semanas posteriores a esa primera dosis, o sea, por lo menos 42 días entre su primera y segunda dosis, y todavía la efectividad sigue bien. Sabemos que muchos de ustedes en otros sectores todavía esperan pacientemente su turno para poder agarrar la vacuna. También se les recomienda que por favor consulte a su proveedor médico y su empleador sobre la disponibilidad de la vacuna y de su turno para poder saber cuándo la van a recibir. También recomendamos que usted visite a nuestro nuevo programa VaxLB, deleteado V chica AX LB grande. Ese es un portal de vacunación en línea de la ciudad para inscribirse y recibir notificaciones cuando sea su turno. El sitio y el formulario de registro facilitan y hacen más transparente el proceso de aprendizaje y la programación de las vacunas de COVID-19. El sitio y el formulario de registro están disponibles en español para todos ustedes. Puede ir al sitio de web longbeach.gov/VaxLB, deleteado V chica AXLB grande, para registrarse. Aquellas personas que quizás no tienen acceso a internet o no saben usar el internet, pueden también llamar al área 562-570-INFO para poder obtener asistencia en registrarse. Queremos asegurar que todas las personas tengan acceso a poder registrarse en VaxLB. Quiero recordarle a todos que estamos trabajando agresivamente con el gobierno estatal y federal para recibir la mayor cantidad de vacunas posibles. Hemos mencionado anteriormente que el alcalde dice que tenemos la capacidad de poder administrar muchas más vacunas, ya que estemos recibiendo un aumento de vacunas. También el alcalde mencionó la pandemia está muy lejos de terminar, y estamos recomendando que todos tengan cuidado, especialmente este fin de semana que viene. A medida que nos acerquemos a este fin de semana, va a llegar el domingo, el Super Bowl, y queremos recordarle que por favor celebren con cuidado, con solo su familia inmediata, con miembros de su hogar. Hemos visto en el pasado, después de las reuniones navideñas y también después de la Acción de Gracias, los números de COVID-19 subieron drásticamente. Así es que por favor tengan cuidado, continúe usando su máscara facial, manteniéndose la distancia física y limitando esas reuniones con personas que están fuera de hogar. Estamos doblando la esquina y estamos superando esto juntos. También nos acompañó la doctora Anissa Davis, que es la oficial de salud de la ciudad, quien dio una actualización sobre los números aquí de COVID en la ciudad de Long Beach. A la fecha, 46,833 residentes de la ciudad de Long Beach han dado positivos por COVID-19 y hemos perdido un total de 618 residentes aquí en la ciudad de Long Beach debido a COVID-19. Actualmente tenemos a 287 residentes de la ciudad hospitalizados por el virus y la tasa de positividad ha bajado un poco a 9.7%, que es lo más bajo que hemos visto desde el 9 de diciembre. Así es que vamos a tener mucho cuidado este fin de semana con el Super Bowl y mantener esos números bajando. La doctora Davis también habló sobre los informes confirmados recientes de una variante de COVID-19 conocida como la B117 en el condado de Los Ángeles y en algunas áreas vecinas. Esta es la misma variante descubierta en el Reino Unido el otoño pasado. También se han encontrado variantes originarios de Sudáfrica y Brasil en los Estados Unidos, aunque todavía no ha llegado a California hasta este momento. Dado que los virus cambian constantemente por mutación, se espera que aparezcan nuevas variantes de un virus con el tiempo. A veces surgen y desaparecen nuevas variantes y otras veces aparecen y persisten esas nuevas variantes. Se cree que el B117 se está extendiendo en el condado. Actualmente, aunque no haya evidencia definitiva de que la variante cause una enfermedad más grave o un mayor riesgo de muerte, la presencia de la variante significa que la transmisión del virus puede ocurrir más fácilmente en nuestra comunidad. Enero fue el mes con más fallecimientos hasta ahora en Long Beach, con aproximadamente 245 personas que perdimos el mes de enero y en comparación con 150 muertes el mes de diciembre. Por favor, vamos a tener mucho cuidado. No podemos permitir que esa tendencia continúe en este mes de febrero. Queremos asegurarnos que no haya más fallecimientos debido a un virus que se puede prevenir de ser pegada a otras personas. Las vacunas actuales que tenemos disponibles, las vacunas de Pfizer y Moderna, son efectivas con esta variante del Reino Unido. No sabemos qué nos depara el futuro y por eso tenemos que tener mucho cuidado. Para tener menos variantes necesitamos tener menos virus circulando aquí en nuestra comunidad y transmitiéndose uno al otro, por lo que es muy importante vacunarse si tiene la oportunidad y continuar con todas las precauciones que está escuchando una y otra vez. Usar esa cubierta facial, no reunirse con personas fuera de su hogar, evitar multitudes, lavarse las manos y quedarse en casa cuando usted está enfermo y también lo más posible. Seguir esas precauciones puede ser literalmente una cuestión de vida o muerte para algunas personas. Aunque vemos otros números como los casos nuevos y la tasa de positividad con tendencia que ya se está bajando, lo que nos da esperanza ciertamente es no desaprovechar ese momento que ya va bajando bajando esos números. Incluso mientras seguimos vacunando a personas, es todavía necesario tomar esas precauciones. Aunque usted haya tenido 1 o 2 dosis de la vacuna para COVID-19, asegúrese que todavía siga usando su cubierta facial. Estas estrategias solo serán eficaces para frenar la propagación si las siguen todos en todo momento. Por eso es tan importante que, a pesar de que se ha levantado esta orden regional de quedarse en casa y ahora se permiten más actividades, sigamos siendo reflexivos al tomar decisiones y no nos apresuremos a reanudar las actividades que quizás nos pongan en riesgo de contraer COVID-19 y de dar la transmisión a otras personas. Queremos dar las gracias por seguir trabajando juntos para mantenerse sano y proteger a los demás. Gracias por acompañarnos. Eso es todo por hoy. We thank you for joining us. We will see you next week.